Thank you for your interest in the Lifeform CRiSis mannequins. This video is intended to demonstrate the features of the Lifeform CRiSis mannequins that will help you train your students to be prepared, make the correct decisions, and perform procedures properly when faced with various emergency situations. The Lifeform family of CRiSis mannequins includes adult, child, and infant mannequins, which are ideal for ACLS, nursing, paramedic, and EMT training at every level. The Lifeform Adult CRiSis mannequin is a complete training system with 5 stations allowing you to practice different scenarios. You'll be able to perform CPR, intubate and ventilate the patient, monitor and evaluate blood pressure, start IVs, and defibrillate just as you would a real patient. The airway management trainer represents a non-anesthetized patient. Applying cricoid pressure changes the position of the trachea and closes the esophagus, allowing for realistic practice of the Selleck maneuver. The lifelike anatomy and landmarks, such as nostrils, tongue, vocal cords, and cricoid cartilage, allow you to practice intubation, ventilation, and suctioning techniques. The defibrillation chest skin is completely compatible with all manufacturers and makes of defibrillators on the market. An internal load box absorbs the full strength of every shock to protect students and equipment. The load box is designed to handle up to the maximum recommended 360 joules, totally eliminating the possibility of damaging your expensive defibrillator or patient simulator. When used in conjunction with a patient simulator, the defibrillation chest skin makes it possible to monitor the mannequin, just like a real patient. The IV arm features realistic vinyl skin and latex veins. The arm pivots at the elbow for easy access to the antecubital fossa, the forearm, and the back of the hand. A bony landmark at the shoulder helps identify muscle tissue for intramuscular injections. The skin actually rolls as you palpate the vein, and the characteristic pop can be felt as the needle penetrates the vein. Realistic flashback occurs with proper insertion. The blood pressure simulator allows the instructor to set and alter the mannequin's blood pressure in response to students' actions. You can set the values for both systolic and diastolic pressures. The Korotkov phases can be turned on and off with a switch, and volume and pulse rate are also adjustable. The student monitors the readings through a speaker in the arm. An optional external speaker is available, allowing sounds to be heard during group presentations. The adult Lifeform CRiSis mannequin is now available with the new option of auscultation sites featuring heart and lung sounds. This unique technology allows the instructor to select from a menu of 12 heart conditions and 16 lung conditions using the wireless remote control. The students must palpate to identify the correct auscultation locations, and will hear different heart or lung sounds as the smart scope is moved to different locations on the mannequin. Heart conditions covered include normal heart sounds, aortic regurgitation, mitral stenosis, pulmonary stenosis, hollow systolic, mid-systolic, S3 gallop, S4 gallop, systolic click, atrial septal defect, PDA, and VSD. The lung sounds that are simulated include normal sounds, wheeze, monowheeze, fine crackle, ronchi-crackle, coarse crackle, cavernous, bronchial, stridor, friction rub, pectriloquy, egophony, pulmonary edema, bronchofascicular, and infant. There are 6 heart sites, 5 anterior lung sites, and 2 mid-axillary lung sites where sounds can be heard. A diagnosis can be made by comparing the variations in sounds occurring at different sites, just like a real patient. Instead of an individual using the earpieces on the smart scope, an optional amplified speaker can be used, allowing an entire classroom to hear the heart and lung sounds at the same time. Simply plug the amplified speaker into the speaker jack located on the SmartScope. In addition to the complete CRiSis Manikin, there are packages available with a patient simulator, printer for CPR evaluation, and a hard carrying case. There are also 2 torso mannequins available that provide the same quality, durability, and reliability as the full-size mannequins, only in smaller, easier-to-transport versions. Although we recommend the complete Manikin, the components can be purchased separately to update your older mannequins. In addition to the adult CRiSis mannequins, Lifeform has also developed a child CRiSis Manikin representing a 5-year-old child. The child version allows you to perform all the same procedures as the adult CRiSis Manikin, plus intraosseous infusion and femoral access. For the intraosseous infusion feature, there is a pressurized system to allow aspiration of fluid, plus a 4-sided replaceable bone. Femoral access features include palpable arterial pulse, realistic flashback from the pressurized venous system, and replaceable injection pad. The child CRiSis Manikin is also recommended as a complete training unit. However, the individual components may be purchased separately to create a mannequin to suit your needs and budget, or to update an older mannequin. A deluxe version is also available that includes an arrhythmia simulator. The infant CRiSis Manikin is the most recent addition to the Lifeform family of CRiSis mannequins. This dramatic training mannequin is ideal for teaching pediatric advanced life support to nurses, paramedics, and EMTs at every level. The mannequin allows practice of many of the same procedures as the child CRiSis Manikin. In addition, the infant CRiSis Manikin has a unique chest skin with an umbilical cord, which allows practice of proper techniques in umbilical catheterization, including cutting and clamping. Fluid may be aspirated through the replaceable umbilicus, making this mannequin incredibly lifelike. Lifeform PALS kits and individual components are also available to transform old mannequins into state-of-the-art pediatric advanced life support mannequins. We hope this video answered some of the questions you may have had about the Lifeform family of CRiSis mannequins. As you can see, each CRiSis mannequin is a complete training unit. They're designed to allow you to train in the same way you would work on a real patient.